What are the bioethical concerns of moral enhancement? Have you ever thought about how technology could change our moral values? Today, we are discussing the bioethical concerns surrounding moral enhancement. This concept involves using medical or technological methods to improve our moral capacities, like kindness or fairness. But this raises some important questions about ethics in healthcare. First, let's talk about autonomy. Autonomy is the right of individuals to make their own choices. If we use technology to change someone's moral feelings, we might take away their ability to choose for themselves. This could lead to a loss of personal identity and authenticity. When people cannot act based on their own beliefs, it raises serious ethical concerns. Next, we have the principles of beneficence and non-maleficence. Beneficence means doing good, while non-maleficence means avoiding harm. With moral enhancement technologies, we need to consider their safety and potential side effects. We do not fully understand how these interventions might affect someone in the long run. If we cannot guarantee safety, we risk causing harm, which goes against the medical obligation to do no harm. Justice is another key concern. If only certain groups can afford moral enhancement technologies, this could worsen social inequalities. There is also the risk of societal pressure to undergo these enhancements. This could lead to discrimination against those who choose not to participate, infringing on individual rights. Another issue is the lack of agreement on what moral improvement really means. Different cultures and ethical theories have varying views on which traits should be enhanced. This disagreement complicates the ethical justification for moral enhancement. It could lead to imposing specific moral values on diverse populations, which is problematic. The methods used for moral enhancement also raise ethical questions. Unlike traditional moral education, biomedical interventions might bypass critical thinking and reflection. This could turn moral growth into a simple biochemical process, rather than a genuine development of character. In the realm of advanced medical technologies and prosthetics, moral enhancement challenges our understanding of therapy and enhancement. Just like prosthetics raise questions about human identity, moral enhancement forces us to think about how far we should go in altering human behavior and character. In practical terms, it is essential to approach moral enhancement with caution. Instead of broadly trying to enhance morality in healthy individuals, we should focus on specific cases, like treating pathological moral deficits. Ethical medical practice requires thorough risk assessments, respect for patient autonomy, fair access, and open discussions about these technologies. The bioethical concerns surrounding moral enhancement highlight the importance of respecting individual autonomy, ensuring safety, promoting fairness in access, clarifying moral goals, and carefully considering the means of enhancement. These factors must guide any healthcare decisions involving moral enhancement interventions.